When most people talk about losing fat, they're talking about losing subcutaneous fat. Sub just means below and cutaneous means skin. So it'd be this fat right here directly below the skin. And as you can see, it can be up to inches thick, and this fat would cover up the rectus abdominis right here, that six-pack muscle. Here's another example of some fat that would cover up the deltoid muscle. And so the idea is partly aesthetics. People want to have their muscles shine through. And so if the fat can be thinned out on top of the muscles, then those muscles could more clearly shine through in all their striated glory. Now, even though it might be nice to have thinner subcutaneous fat so that you could see those muscles more clearly, that doesn't mean we shouldn't mention visceral fat. Visceral means pertaining to internal organs. So this would be the fat surrounding the organs. Here's the abdominal cavity, up here's the thoracic cavity where you'd find the heart and lungs. Now, this particular body, or this dissection, is actually a little bit more tricky to make out specific structures and organs. And that's because it has such a buildup of this visceral fat. Like, look how thick and fatty this greater omentum is. You can see these thicker fatty appendages coming off the intestine and that buildup of visceral fat in between. What's even more remarkable is the amount of visceral fat around the heart. Yes, the heart is inside here. And it's crazy to think about, especially when you see what a normal amount of visceral fat around the heart looks like. Now, the visceral fat inside here is sometimes also referred to as deep belly fat, because as it builds up inside, it can kind of push on your abdominal wall and increase your waist circumference.